In 2019, the Centre for Economic and Social Research on Dementia convened a series of events to explore important issues for older people and people with dementia. A policy symposium brought national and international experts together to consider ageing, social care and social justice. A policy cafe for people with dementia discussed diagnosis and home care. And a carers assembly prioritised issues of concern for carers of people with dementia. The final event was a policy dialogue to consider home care.
Well, the purpose of today is to bring together people to discuss what the future of home care services should look like, how they should be regulated into the future, how they should be funded and provided, and what should be included in a home care service.
It's a policy dialogue, so it's bringing people like ourselves, the advocacy groups, and we provide services together with researchers, with people from the department, from the HSE, from the regulators like HICWA. So it's very important. We're all there in our own position as Chatham House rules, and we're listening and we're contributing, and we're talking about the main issues that face us now into the future in relation to home care.
People are really taking time to listen to one another, to really, trying to arrive at some kind of consensus, but also trying to look at what home care would really look like if we were able to, take that vision that the people at the Policy Cafe and the Carers Assembly really put to us and see whether we'd be able to translate that into practice.
We're at a stage now where we're being given the opportunity to define what home care services should be into the future against the background of how those services should be managed and regulated. So it's really important that all stakeholders in the sector get an opportunity to hear what's being said, but also to contribute to that conversation. So it's a broad forum of people gathered today to talk about this, with a mixture of viewpoints from policymakers to service providers to service users or their representatives. And I'm here representing regulation in that conversation.
All government policy and the policy of advocacy groups is to allow people to live in their own home with supports. But we've never really defined what those supports should be. And oftentimes then if they're not there, people end up having to go into nursing homes unnecessarily or maybe earlier than they might need to if those supports were available to them at home.
Well, at the moment, the way we see home care is really home care workers who come into people's house to help them with what we call activities of daily living, or instrumental activities of daily living. So getting up, getting dressed, getting washed, maybe helping with some housework, do some shopping. So that's kind of what it looks like at the moment. What people are talking about is really trying to transform that into a kind of a support that would help people to do what's needed at home, not just to get up and get washed, but maybe to work with them to go to the shop or to connect them into the community. So it's a much broader range of supports.
The family have traditionally provided much of the home care, particularly for persons with dementia. So it's a big issue because many people are not available now to provide home care. So the question is it the family's responsibility to continue, or does the state have to take a role in relation to that? And if the state has to take a role, well then that has to be paid for. So who pays for it? Is it paid by general taxation, or should the family or the individual themselves have to provide it? And then how should it be regulated? So there's a whole range of very difficult and contentious issues that are going to face us when we talk about a statutory home care scheme.
The way in which home care is currently funded is through general taxation. My personal preference would be for a social insurance scheme like they have in some other countries like Germany. The reason that I believe that is important is because it actually shares the costs of caring across the whole population. So we're coming from this from a kind of a collective point of view rather than individuals having to bear the costs or the state having to completely bear the costs. So by people contributing to a social insurance scheme, it's actually, I suppose, an acknowledgement of the collective responsibility that we all have for caring for older people and people with dementia.
Personally, I think it's going to need some degree of co-payment from the individual or the family. We have that in the Fair Deal scheme, and it seems to be acceptable to the public. So really what's happening is that the Fair Deal has become the default situation.
This is about more than the policymakers delivering a policy. This is about the people on the ground who are in receipt of the service, the people who work with them, the people who provide the service, and then the people who monitor the service, all being part of the ultimate conversation.
I think dialogue is extremely important in this situation, because normally my role is to advocate for people with Alzheimer's or dementia. So that's my total focus. It's not about who pays for it. It's about people who have this need. So I've got to sit and listen to people who have carried out research in this, who have evidence of it, who have international evidence, people who have to frame the legislation. So it means that we're all in this together. And we've a better chance, I think, of getting a good solution if we all listen very carefully to each other, because we all have an interest in getting it right this time.
I think it's really important to bring people together, to give them time to actually sit down and tease through some of these ideas, and listening to each other and trying to come up with some kind of consensus. I think what's really important, though, is what happens after this, and that we'll really start to look at how we could actually transform home care into practice in the way that the people with dementia and family carers actually envisage it to be.
The policy dialogue was a productive and supportive forum for discussing some of the key issues to be addressed in the new home care scheme. The wide-ranging discussions of all those who participated were captured and will be shared with the Department of Health as a constructive contribution to the development of the new home care scheme.